continue to the Asmet Hair Transplant Clinic. A hair transplant is a procedure in which hair is redistributed into hairless or sparsely haired areas. Since the hair roots come from the patient himself, one also speaks of own hair transplantation. So our next stop is Asmet, and you do hair transplantation. Tell us about it.
Asmet, I'm doing hair transplantation for 22 years, and only hair transplantation, nothing else. This building is around 10,000 meters square. We only do hair transplantation for a very long time.
How much did it grow? How many people want hair transplantation, and is it mostly men or women too?
Yeah, 95%, 98% men, because the reason of hair loss with women and men is different. So mostly hair transplantation is working for androgenic alopecia, which is related with men hair loss.
Okay. How long is an operation? Many hair? Can you count those hairs?
It's possible to count them. So it's not easy to count up. That's the reason we use the more robotic system for counting and evaluating the patients before the surgery. Because hair transplantation, people doesn't know that it's related with mathematics mostly. So that's important to calculate the number of the follicles that you can take from the patient and the density per square centimeter, all these type of things. You need mathematics and calculations, so that's the reason.
And we you showed us around, and there's a new technology which you invented. Tell us about that.
Yes, keyboard and key photo, the two technologies. One of them is an identical photography system. You know that because when you want to share your results or when you see the operation, how it works after the surgery, you need identical photos. So this system is taking the photo with one step. It's easy for the patients and it's identical for me to evaluate also before and after photos. And other thing is a robotic scanning system. It's a deep learning system. Before the surgery, after shaving the hair, the robotic system is scanning all the donor area, and you are calculating the number of the follicles per square centimeter, density, the caliber of each hair. It's not possible to do that by manual way. It takes maybe 1 week to evaluate one patient, and this robotic system is doing it in 6 minutes. And after the surgery, when you transplanted the grafts, how many grafts per square centimeter, and the density, the patients are always asking, doctor, which density you did in the first frontal part. So the robot is calculating is, and how many grafts? The patients are coming here and they're paying for 600, for example, or 3,000 grafts. But who knows how many grafts transplanted? It's not possible to count one by one. So also this robotic scanning system are giving them more confidence about the number of the grafts and the quality of the surgery.
So what I think it's perfect, it doesn't take that long the operation, 5-6 hours, but then the patient can go the next day. So you can be a tourist in Istanbul, come to your clinic at the last 2 days, and then you go home.
Last 2 days is important.
Yes, for you.
Because even it's not so painless, we don't recommend to walk under the sun with the transplanted graft. But it's possible. It's not painful. Most of the patients, even I give them a painkiller, they don't use them. So they can travel the next day.
And they have to come back for a follow-up?
Only the next day I check them, and they don't. If they are sending me the photos, if they have any problems, for example, of course they will send me photos. Sometimes some patients are complaining with redness, which sometimes, depending on the skin sensitivity, it may take 3 months in some cases, not everyone. So this type of complications, they are sending me photos, they are calling me, but it's not. There is no serious complication.
So in your words, who you suggest who should come?
Yeah, this is the the most frequent question. People, doctor, do you think that I need hair transplantation? This is the only question that I don't know about hair transplant. This is something personal decision. If you're happy with your baldness, you don't need it. But if you're looking at the mirror and you want something more, you can come.
Perfect. Thank you very much.
Thank you.